Sex trafficking in general, there's this kind of expectation or normalization of that process in the media that we see of females. This idea that only females are trafficked, or that young girls are trafficked by somebody in a different country. But also, as we do the research and as we expand our research criteria and our understanding of the individuals who are coming for care, they are actually finding in the research that it's up to 50% of sex trafficking victims are male youth. The problem is, because we have these cultural expectations that it's going to be a girl or it's going to be a woman, the way we ask the question and the way we code the response kind of excludes males from the data. So my name is Landon. I'm the Director of Clinical Services for Ranch Hands Rescue. And my involvement started a few years ago, and I started as an individual therapist out here. I met Bob, who's the founder and CEO for Ranch Hands Rescue, and he has his own trauma history, which I'll let him go into.
I was working as a job that summer before my senior year of high school as a kids photographer. I went back to my hotel room and went to sleep, and at 4 o'clock in the morning I woke up with a knife to my throat. I was brutally beaten and I was raped. I spent a week in the hospital. And my dad, when he picked me up from the hospital, he said, "We're never ever talking about this again. You sweep things under the rug. You don't discuss it." And I couldn't process it. I couldn't process what happened to me. In 2007, I had a stroke. That was a real eye-opener for me. It was extremely frightening. Whatever time I have left, I want to do something really good with my life, but I had no idea what it was going to be. And so I started saving animals by accident as something to do. I would go to the doctor, the heart doctor and the neurosurgeon, and they would say to me, "What's happening with you?" They noticed this change in me, and the only thing I could attribute it to was the animals. I didn't quite understand it, but I knew that they were having an impact on me. I started to save animals, and in those days we had a big rescue. We were taking special needs animals. We established a sanctuary, and we became a public charity in 2009. I wanted to develop a program for people like me, people that didn't see any hope. This program was designed for the 1 to 8% of individuals that need a different or more alternative approach to mental health.
This is where we get the people helping animals part, where these animals actually help with the trauma recovery because they get it. They get it on a neurobiological level, what it is to be in a traumatic incident, to work through that and then survive and have hope and dignity on the other side. And so what ends up happening out here is we have trauma-informed professionals, then we have these animals who have lived it, and they work together with clients who've been through trauma to produce these incredible outcomes that nobody thought was possible with unhealthy animals.
In 2010, our counseling program was formed, and we started off with the Children's Advocacy Centers, and then from there it just exploded. As the word got out about the successes that we were having, we really started to grow, and today we have 28 partner agencies. And so what happened was I got asked to be part of this coalition for the sex trafficking task force, and we had sex trafficking victims in our program at that time. The youngest sex trafficking victim that we had in our care was 6 years old, and we had a 15-year-old boy who had been sex trafficked also. And so one day I just asked the question, is there a problem with boys? And Judge McCary stood up and said, "It's the single biggest problem in the country today, and nobody's talking about it." What was fascinating was I was having a conversation, and I was looking at stings that they were doing to arrest predators who were going after young girls. And so I was like, okay, where's the boy stings? You know what I mean? And everybody looked at me like I had 3 heads.
So we may not say to someone explicitly, "You shouldn't be getting help for this," or "This shouldn't be a problem," but we might send that signal by some of the subversive language we use or the body language that we use. And when that message gets sent to a male, especially a male who has been through sexual trauma, then it makes it much less likely that they will seek help. And even if they do seek help or someone makes them go get help, they're not as likely to open up, and they're also not as likely to identify themselves as a victim.
The problem with society today is what we're taught. You must be masculine or be a certain way, all right, to be a man. The stereotype has to be changed, and the only way that it can be changed is through education and awareness that it's okay to show your feelings and to talk about things that have happened to you.
Men feeling those things is not as culturally acceptable, especially in the South, as it is for women. And so that adds another layer of barrier here. And that leads into some of these other stigmas and myths that we're trying to combat, such as men can't be raped. Yes, they can. Boys can get away. Not always. It's from a stranger that they met somewhere or met online. Not always. This expectation or this normalization that females are the only ones who are trafficked has led to a lack of resources for males and a lack of recognition for males.
The myth is that boys can get away. So there's never really been any studies about how big this problem is. We're just now starting to collect the data, but we call boys the unseen survivors. In 2019 was when I made the decision to, the end of 2019, December 2019, to open up the Safe House. And again, that was because there wasn't one. So it was, filling the void. We've got the three niches, as I call them: the farm animal sanctuary, the counseling program for the 1% to 8% of individuals that need a different or more alternative approach, specializing in kids that have been sexually abused or sex trafficked, and then now the first safe house in the country for young men 18 to 24 that have been sex trafficked.
The primary focus for opening Bob's House of Hope was that we noted a lack of opportunity for young men to get the help they truly need anywhere in the country. And there needs to be a single point of contact and a safe place for them to return to as they work through all the stages of trauma recovery. And you can't do that by hopping from treatment center to treatment center, which is the current kind of way it happens. And one of the most horrific aspects of this is that the number one provider of mental health care in the country is the criminal justice system. And this is especially true for young men who've been sex trafficked, because they are performing survival skills that happen to break the law. So in their attempt to survive in this dark, horrible world, they might steal something, or they might break in somewhere, or they might engage in survival sex, which gets them picked up for prostitution, or whatever kind of criminal charge, and that's where they end up getting care. And that doesn't work. It's not an effective strategy for treating this level of complex trauma.
And we started getting phone calls typically from law enforcement, where they've arrested a trafficker, they have a young man, and there's no place to put them. There's beds available, but they're at risk of being re-trafficked.
So part of the vision at Bob's House of Hope is to create this sustainable model for young men who've been sex trafficked. And what that entails from a clinical perspective is a combination of therapeutic interventions. There'll be case management, which involves medical, dental, legal services, educational services, vocational services, and then share that model with the rest of the country so that there can be more programs like this that address the full scope of complex trauma and of what it takes to recover from something as horrific as being sex trafficked.
We were on an incredible path to raise significant money in 2020 until COVID hit. And when COVID hit, everything changed.
To be quite honest, things like sex trafficking actually get worse during a pandemic because so many things go underground and so many things go unnoticed and unattended to. And we decided that despite all those challenges, we weren't going to stop. Sex trafficking doesn't stop, and neither do we.
We have to try. And I tell everybody that, doing nothing is just not an option. Not only did we meet our goals for last year, we exceeded them. We just did our second rescue yesterday. And so we've got a 20-year-old boy, okay, who's a straight kid, who's crying with us because he's been forced to do unthinkable things, hooked on meth, hooked on heroin, all right? It's a disaster. There's not one rational person that can even understand this. You can't comprehend what traffickers put these kids through because it is actual human slavery. So we have to change the stigma about what happens to boys and young men in terms of if they were sexually abused. We've got to be able to lift that shame and guilt from them. And I think that the biggest problem is that people are uncomfortable talking about sex trafficking in general. They're certainly uncomfortable talking about boys and young men being sex trafficked. You know, my hope is that people can look at our program and say we can do the same thing in LA, New York, Boise, Idaho, wherever, all right? We'll share all the data and the information with anybody that wants it so that people can do the same thing.